Disproportionate Eye Disease in the Hispanic Population by Giselle, Jurisdiction, the U.S., and Client, the American Diabetes Association. How can Congress address and prioritize the disproportionate risk of type 2 diabetes among the Hispanic and Latino population, and what measures can be taken to enhance diabetes management and reduce diabetes-related complications such as diabetic retinopathy? For some background, according to the U.S. Census, Hispanics are the largest racial or ethnic minority. Americans have a 40% chance of developing type 2 diabetes, but Hispanics are at a 10% higher increased risk. Poor diabetes management can lead to diabetic retinopathy, one of the leading causes of blindness and low vision in the U.S. From data sourced by the NEI, collected in 2010, we see the U.S. diabetic retinopathy projections by race and ethnicity. By 2050, it's expected that more than 14 million U.S. adults will have diabetic retinopathy. We can also visually appreciate the sharp increase that is projected for the Hispanic population, especially in comparison to the other racial and ethnic groups. From the same NEI data source, we see the 2010 U.S. prevalence of diabetic retinopathy by age. As expected, diabetic retinopathy is more prevalent in adults over 65. But here we see, in the age group 65 to 74, the Hispanic population has almost double the prevalence of disease than the other groups. Policy landscape. Here are the political, social, economic, and legal factors impacting the prevalence of Hispanic diabetic retinopathy. Political factors that influence diabetes management are healthcare policies, insurance regulations, and funding for the diabetic research. Policies set forth by federal agencies such as the Centers for Medicare and Medicaid and healthcare reform laws such as the ACA. Support and expansion of programs such as Medicaid, the CHIP program, and other general insurance coverage may differ depending on political party affiliation and state. Democratic Party efforts to introduce cap insulin costs through the Inflation Reduction Act were recently blocked by the Republican senators. Social factors contributing to health disparities among the Hispanics include language and cultural barriers. A survey conducted in 2021 found that 58% of Hispanic immigrants preferred a Spanish-speaking health provider. However, only 6% of physicians identify as Hispanic and 2% non-Hispanic physicians speak Spanish. Economic factors. They are significant considering the high costs related to diabetes management. A quarter of all U.S. healthcare costs are spent providing healthcare to individuals with diabetes, and the CDC estimates about half of healthcare costs are associated with an individual with diabetes or diabetes complications. The morbidity rate of diabetes in the U.S. is 16.2%, and the mortality rate is 103,294 deaths per year. It is currently the 8th leading cause of death. Lastly, legal factors. Legal factors impacting the Hispanic community include immigration policies that deter individuals from seeking health care due to the fear of deportation. Additionally, undocumented individuals are typically ineligible for federally funded health insurance programs, and about half of undocumented immigrant adults and 18% of documented immigrants report being uninsured, compared to the 8% of U.S. citizens. Status quo. The American Diabetes Association is a leading organization that helps to prevent and manage diabetes by educating, advocating, and funding research. As a chronic disease, the CDC has a diabetes division that helps to increase health literacy by sharing and producing information through research initiatives. Currently, there's a study funded by the NEI called Sol Ojos that is researching the prevalence of eye visual impairment and eye disease such as diabetic retinopathy. But despite these dedicated efforts in advocacy and research aimed at prioritizing diabetes, Hispanics continue to experience disproportionately higher prevalence of diabetes compared to non-Hispanic white individuals. Market and government failures. Diabetic retinopathy is disproportionately affecting Hispanic individuals due to various social determinants of health. Market failures such as information asymmetries are leading to low diabetic health literacy levels. Understanding diabetes prevention, management, and progression are key to reducing the incidence of retinopathy, one of the leading causes of low vision and blindness. Access to routine health care, including eye care, can be challenging to obtain, and one of the contributing factors is the too specific and limited definitions set forth by the ACA that fail to include eye care as an essential health benefit, resulting in a government failure. Private insurance, Medicaid, and Medicare are also impacted by specific state insurance regulations. Although the private insurance market can independently add specific types of coverage based on market dynamics, it would need to be a profitable decision. Numerous government programs and resources focus on addressing the disparity through health literacy initiatives and studying the prevalence of the disease. However, they have not succeeded in improving eye care coverage for all Americans that could more directly address these issues.